Hey guys, Sarah here, just jumping on. I wanted to share a little bit about some common referral patterns that are seen in the lower extremity as it relates to pain coming from either the hip, the thoracolumbar junction, and or the lumbar nerve roots, and how there's some kind of overlap and how we can be better at, as clinicians, looking at the origin of pain and creating a plan that targets the origin optimally. So this is a study I did back in, or a presentation rather, I did back a couple years ago, and I just wanted to share some of the findings. So the hip joint is most commonly referred pain into the buttock area based on this descriptive study that was done a while back. And it is referred to the groin and thigh as thought of before, but it's more frequently pain is referred into the buttock and thigh based on this study. And as you can see, when you look at the frequency of occurrence of referred pain in this chart here, it is, in all the subjects in this study, 71% is referred into the buttock. And when you look at co-occurring pains, it's most frequently occurring in the buttock and thigh. And there's a study by Lesner in 2008 looking at diagnosing hip joint pain. And he talked about looking at the pain maps, performing a thorough history, as well as a thorough physical exam to be able to make a clinical diagnosis that the pain is originating from the hip. Now, this condition I want to kind of highlight, it's called thoracolumbar junction syndrome or Main syndrome. And the thoracolumbar junction is actually a region of the spine where the thoracic spine meets the lumbar spine. And it's posed that the nerves, the dorsal rami of T11 through L1, or the thoracolumbar junction, can cause pain into the groin, side of the hip, or back of the hip as shown in this picture here. Also, when you look at Main study done back in 1980, it's kind of an oldie but goodie. He was looking at 350 patients that came into a back clinic, and he noted that 40% of them actually had pain in the low back and buttock area, or groin or lateral hip, coming from the thoracolumbar junction. And this anatomical depiction here does show the superficial nerves, the sensory nerves, going to the groin, the hip, as well as the posterior gluteal region. That is the classic referral portion of Main syndrome. Now, also looking at the study done by Meadows here in 2019, they were highlighting what Maine found, where if you look at the black points on the diagram, those are classic thoracolumbar junction referral sites, where the side of the hip, the groin, as well as the top of the hip. But you can also see some overlap from the joint referrals depicted in gray, which do refer to the groin and the lower back region, right where those classic main symptom referrals are. So when we're looking at making the diagnosis, we need to be aware of these referral patterns. and do realize that there is some overlap of pain referral patterns from the facet as well as those dorsal rami. This other study by Furman and Johnson in 2019 did look at induced pain into the lower extremity, into the nerve roots that referred into the lower extremity. And it shows quite a bit of overlap. You can see L3 into the front of the thigh as well as the back of the thigh and lower calf. L4 similarly into the front of the thigh and the back of the thigh and calf. L5 stronger referral into the back of the gluteal and thigh region, as well as S1 mostly in the buttock and back of the thigh and calf region. So the classic dermatomal or sensory representation of referral that was taught in school, we can't just rely on that. We have to realize that when there is nerve root pain, there's quite a bit of overlap from the different lumbar levels. And so we should be, as clinicians, using a thorough history, tests and measures, and trying to prove or disprove our hypotheses with